Diseases that coexist with multiple sclerosis. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. And this is a pretty crazy topic. This is something that I have been reporting on for years, and it's really amazing to see the research backing up what we're seeing in people that are diagnosed and living with multiple sclerosis. So, when we have an MS diagnosis, that is difficult enough. But then, and I'm going to talk about my history, but for people that are diagnosed with MS, it's devastating. But then to know that if we follow standard of care, that we will likely have many, many different types of chronic diseases, not just multiple sclerosis in time. And this is what the research is showing. So today I'm going to be talking about what these diseases are and how we can actually prevent them or turn them around, reverse them, and how we can recover from multiple sclerosis. So again, if we haven't met, my name is Pam Bartha, and I was diagnosed with multiple sclerosis many, many years ago. Just one sec here. That might make matters better here. I see the audio, there was something. Is it working now? Yes, it's working. All right. So I was diagnosed with multiple sclerosis 35 years ago, and I was 20 years old, and I was super healthy. I was slim, I was active, and I literally went from being a healthy person all my life for 28 years to losing all vision in my left eye, started getting terrible headaches, and then started getting weakness and tingling in my legs, and then was rushed to a university MS hospital on the west coast of Canada, one of the very best places to be diagnosed in Canada. And there, the neurologist told me, yes, you have multiple sclerosis. And he said, there's absolutely nothing you can do to change the course of your life. You are going to be completely disabled in time. And I was literally devastated. I was in shock. I didn't really know what MS was. I knew that it was bad, but we didn't have any family members that had MS. And again, I had been healthy all my life. So when I got that diagnosis, I really believed that my life was basically over. Long story short, I have, by the grace of God, I learned early on that MS is caused by parasites. And back in the day, which was many, many years ago, the doctors, the forward-thinking doctors were talking about different types, like especially Candida. They were talking about parasites, but they really didn't know much about parasites like we do now. But they were really focused on Candida. So that really started my journey. There were 4 medical doctors that wrote books on this, helping to reverse MS and other chronic diseases by treating infections, especially Candida. So that started my journey. And from there, I tried many, many things over the years, seen many different integrative practitioners. And the more I focused on my microbiome, on treating parasites, the more recovery I had. And I ended up being completely symptom-free now for 35 years. I went back to school, got a science degree, had another child. I really wanted to help people recover like I had. And the crazy thing is that, like, when I was diagnosed, I went from super healthy to having MS, and I thought that was it, right? And so with all the work that I did and all the success that I had when I was going to university, I had a follow-up with a different neurologist, and I wanted to share, like, I have been able to live a few years free of MS. I'm back in university. I've had another child. And when I saw that neurologist, he's like, your gut has nothing to do with your nerves. And that was just like, really? Like, that's all you have to. And he said, MS just goes into remission by itself sometimes. We don't know why. But what you've been doing, it's just luck. By chance, you're in remission. And I was really discouraged that he was so close-minded. And it's really crazy that, because for many, many years we've known, and science knows, that there's this huge, huge gut-brain axis. And I've talked about this in previous different trainings. What I'd like you to do is, like, as I'm talking, maybe you guys can share, like, have you had issues with, let me just see. I just want to make sure that you are there. Yes. So let me know if you have had different kinds of, like when you were diagnosed, have you had other kinds of diseases that I'm going to be talking about? Some of them are not as serious, but some of them are a lot more serious. So I just want to make sure that you guys can see me because I don't see you. Just want to make sure that it's working here. Hold on one second. All right, one more time here because I don't want to talk to myself here but I want to make sure that you guys can see me. Awesome, perfect. Okay, so with multiple sclerosis, we get this horrible diagnosis and it's devastating, right? But we're only thinking like, oh my gosh, I'm going to be in a wheelchair and I'm going to live with MS all my life. We're not thinking about other diseases, right? We're not thinking about cancer and epilepsy and diabetes and heart disease, etc. And so this is a really important topic because since I have recovered from multiple sclerosis, I went back to school, got the science degree, I became a certified teacher, and I have been coaching hundreds and hundreds of people from all over the world, over 15 countries. And what I see, what I have to report is that when people have multiple sclerosis and they're just following standard of care, then they're using the disease modifying drugs. What we see in our students is that they have multiple diseases. They can have 3 to 5 diseases in time. And that's just something that we saw. And so, what I'm going to share with you is research confirming that. It is really, really shocking. And it really makes us think like, are we doing the right treatments for MS? Are we following the right standard of care? Like, is this really health? Are we doing a disservice with our standard of care? And I really believe that we are. So this study, and it's actually a fairly recent study, go ahead and type your questions in the question box. I will answer your questions in a little while. But what they have found is that they commonly see things like depression, anxiety, high blood pressure, cholesterol issues. So that's what we normally see very commonly in our students that have multiple sclerosis. But we also see other diseases like diabetes, cancer, cardiovascular disease, inflammatory bowel, arthritis, epilepsy, and a variety of autoimmune diseases. And the research, the study that I'll be sharing in our blog post on livediseasefree.com at the end of the week this week, we always put together a really great blog post with this video, just tightened up a bit, and then written so you can look at links. You can actually look at the studies yourself. But they found that multiple sclerosis, so this study, the 2020 study, found that multiple sclerosis is associated with numerous other diseases, and they call them comorbidities. So they have pinpoint through looking at many, many different scientific papers. Cardiovascular disease is more common in MS, psychiatric and neurological disturbances, restless leg syndrome, migraines, cancer, autoimmune diseases, and metabolic disorders. So when you hear that, you start to think, well, maybe there's more to MS than just it is a neurological disease where your immune system is just attacking your nerve tissue. It is a multi-system disorder, many different disease labels all in one. So, and they're also finding cancer rates in people diagnosed with MS is higher for certain cancers than in the general population. So these comorbidities or diseases across multiple body systems are common in people diagnosed with multiple sclerosis. And they're really associated with a decrease in their quality of life, and also really helping the progression of multiple sclerosis to happen quicker and more attacks. So basically, helping us to become more disabled, long-term disability more quickly. So with respect to, they mentioned depression, anxiety, cardiovascular disease, epilepsy, metabolic disease, autoimmune diseases, they're all common comorbidities with, or common diseases with multiple sclerosis. So when you talk about cardiovascular diseases, they find that there's more high blood pressure with multiple sclerosis, and heart rate, heart rhythm, and left ventricle systolic function are common in people with multiple sclerosis. So these comorbidities are reported as the second or third most common cause of death in people diagnosed with multiple sclerosis. So I'll say that again. Cardiovascular comorbidities such as abnormalities in blood pressure, abnormalities in heart rate, heart rhythm, and left ventricle systolic function are common in people diagnosed with MS, and these comorbidities have been reported as the second or third most common cause of death in people with multiple sclerosis. So when I was diagnosed with MS, I wasn't thinking about all these other diseases that I could possibly get. I just thought I was going to be in a wheelchair, disabled with multiple sclerosis. Psychiatric comorbidities are a major concern in people with multiple sclerosis, and they're also associated with fatigue and also reduced quality of life, of course. So mood dysfunction, and including depression, anxiety, bipolar disorder is common among people diagnosed with multiple sclerosis, higher than the general population. So there's more of this mood disorder with depression, anxiety, and bipolar in MS than in the general population. We're at higher risk of having these psychiatric comorbidities. And the mood disorders are associated with rapid disease progression and overall decreased quality of life in multiple sclerosis. Interesting. So these mood disorders are linked with more rapid progression of MS. And they can occur before the onset of like the first neurological MS symptom. So looking here, restless leg syndrome is characterized by a restless urge to move your legs, and it's often accompanied by unpleasant sensation. And it can also be occurring more at night. And it really, really affects our sleep for sure and our quality of life. And it is frequent in people that have multiple sclerosis more so than people in the general population that don't have MS. Epilepsy is more common in people that have MS than in the general population. And they don't know if epilepsy is triggered by the first MS attack or whether MS is a risk factor for developing epilepsy, but they're linked, which is crazy because a lot of research is showing that epilepsy is caused by parasites in the brain. And then when you talk about things like migraine and fibromyalgia and eye comorbidities and also dysfunction of our taste and smell, here pain is also associated with the most debilitating clinical symptoms in patients with MS, and it really impacts quality of life hugely and mobility. And so it's characterized by widespread musculoskeletal pain, fibromyalgia, and this all shares many features with multiple sclerosis. And then also migraines is another really common comorbidity in multiple sclerosis. It's highly prevalent in people with MS compared to the general population. And I talked a bit about lesions in the central nervous system. I did that on a previous call or a live event. And there you'll see that on our blog post, but migraines, those people that are suffering with migraines, they usually have these lesions also in their central nervous system. And then cancer. Cancer is some studies show that some cancers is not clear, but they have found that certain types of cancers definitely are more common in people that have multiple sclerosis. So the meningioma, and I've had a couple of students with that for sure, urinary system cancers. We know that MS, they have a lot of issues with bladder function for sure. So the parasites are definitely infecting the bladder and the kidneys. And what I really found, I just want to end it here, but they said studies that investigated using the disease modifying immunosuppressive MS drugs compared to people that have MS, like some of them are using the disease modifying immunosuppressive MS drugs, and other people diagnosed with multiple sclerosis are not using those disease modifying immunosuppressive MS drugs. And they're finding that the cancer may be increased in people that are using the disease modifying drugs. And that makes perfect sense because we know that cancer is also an infectious disease, and people with MS, the students that I have worked with, some of them have had different types of cancer, like breast cancer, for example. I'm sure prostate cancer, so different types of cancer. But and this was confirmed by a couple of Dr. Alan McDonald and a university professor that I just spoke with recently, they both said if MS is caused by a parasitic infestation, and then we are giving these immunosuppressive drugs to our patients, that can have devastating impacts on their health. Because if you're infested with parasites and then you suppress your immune system, then you are more susceptible to more parasites, right? And so that's why I believe a lot of these different comorbidities exist with MS. The exciting thing, I don't want to leave you here with, this depressing thing like, oh my gosh, now I don't just have MS, but now I could get all these other diseases. No, you don't have to get them. When our students work with us, when they're diagnosed with MS, yes, some of them, a smaller number, will have diabetes or cancer or other autoimmune diseases or epilepsy. They have those conditions. Not most of them, but some do. A lot of them do have depression, and many have anxiety, and many have cholesterol issues and blood pressure issues. Those things can be turned around pretty quickly. And even diabetes, what we find with, when our students start to just even follow the live disease-free diet, if they have MS and diabetes, their diabetes symptoms just settle right down, like really quickly, even without treating anything. So there's so much we can do with even just changing our diet and our lifestyle to really improve our quality of life. But ultimately, to get rid of these diseases and multiple sclerosis and prevent further diseases, we have to treat the parasites that cause MS. And we don't want to suppress our immune system. It's very important that we decrease the burden of the parasitic infestation. We support our body, we support our immune system so that our immune system is helping us. That's what its job is. Its primary job is to defend us from infections and toxins, and most of the issues that they come across would be from infections and the toxins produced by these infections. So the first step, go ahead and type your questions in the question box, and I'm going to answer those in a few minutes. But number one, like for bladder issues, like to decrease the risk of bladder cancer, to decrease all of the urinary tract infections that I haven't even mentioned here, but the bladder, all of the horrible bladder things we go through, going low carb is huge, but you have to go quite low carb. So it's not keto and it's not paleo, it's kind of in the middle. And the difference between paleo and the live disease-free diet is that we're not having dairy and we're having more vegetables, so it's healthier, but we are still quite low carb. If you can get down to about 30 total grams of carbs, it's night and day different. That's for cancer, that's for diabetes, that's for bladder issues. We see all kinds of neurological symptoms improve. We see people that have really low blood pressure, it starts to come back to normal. People with high blood pressure, their blood pressure normalizes. We're having lots of healthy fat, their cholesterol normalizes. So the cholesterol issues that we're dealing with, they're caused by inflammation. It's not caused by fat. That's what we were told for many years. It was incorrect, and it's caused by fat. It's caused by inflammation. So these parasites cause inflammation, and they can cause inflammation in the lining of our blood vessels, and our body will produce cholesterol to kind of protect our veins and protect us from this inflammation. And so as we stop feeding the infections and we start treating them, we notice that cholesterol normalizes, blood pressure normalizes, whether it's too high or too low. And then, of course, sometimes we do have to support, we haven't even talked about things like anemia. Sometimes we have to support, taking a supplement from a health food store and supporting our thyroid. All of those things we're doing in our prep phase. So, with the Live Disease Free plan, which is not specific for any disease, as I've just mentioned, a lot of people that I coach that have MS, they have multiple diseases. And I work with people that don't have MS also. But first, we stop feeding the infection. So we decrease the carbs and we notice a really significant improvement in some of those basic, and even things like depression and anxiety can really settle down. And we are taking a binder to suck up the poisons. We're making sure we're having daily bowel movements. We're sleeping at least 8 hours per night. So a lot of these like smaller disorders and diseases, they're starting to resolve just with preparing to treat. And then when we do treat, and this is where we use a layering of parasite drugs and we use oxidative therapy, which is like oxygen therapies, and the herbs, that is where people, they, resolve not just multiple sclerosis, but other diseases. In one of our students, she had MS, and I've actually, I think in one of my more recent masterclass trainings, I'm not sure which one, but her name, I don't want to say her name here right now, but you can probably find it on the masterclass training. But she was a mom working, single mom, and she had MS and she had a meningioma tumor. And then just through the prep phase in treating and treating, the meningioma tumor shrunk so much that it disappeared. And then her doctor said, well, maybe you never had that tumor. And then she became symptom free of multiple sclerosis. And he's like, well, maybe you never had MS. And so the key is that when you do the right things, it doesn't matter what disease you're dealing with, they're all linked with chronic infections. And so this is where we see all of these different symptoms go away. And I don't know if I've actually put her success on our website. I'm definitely going to put her, because I got an update from her. Like, she did our program probably close to 10 years ago, probably at least 6 or more years ago. And I just got an update from her, and now she is a coach. And she looks absolutely stunningly beautiful. And we see this with a lot of our students that are recovering. Another student, Melissa, I did post hers on YouTube. She has now got her own health food company. She just wrote a book. She's been MS free for 9 or at least 9 years. And she had to relearn how to walk. So diabetes is something that I've seen, like, it's crazy how simple it is to reverse the symptoms of diabetes, even just with diet. And this was confirmed when you go on YouTube. You can see that there is this doctor, I can't remember what her name is, but she's got a TED talk on like low carb diet for diabetes. And I listened to that many years ago, and she was so fired up because she's like, going low carb has helped our patients like totally decrease all of their medications, like unlike anything. So we really have to rethink the way that we're doing healthcare. When we have, like, now for 35 years since I was diagnosed with MS, and we still don't know what causes MS. There is still no cure. We're using these very expensive immunosuppressive drugs. And then we have all of these comorbidities. This is not working. Like, these newer drugs can be at least $200,000 to $400,000 per year that are being billed out. And then to see research showing, well, they might increase your risk of comorbidities, which makes sense, because if they're suppressing your immune system and you're dealing with a parasitic infestation, then obviously it's going to make matters worse. We really have to create change, and you guys are the foot soldiers to make change happen. I can only report the research. I can report our findings. I build a plan, a proven plan that works, that helps people recover from parasites from all over the world. We support people in many, many countries, like even India and Israel and the Caribbean and Australia, New Zealand, all over Europe, Canada, the US. But I can't do this by myself. There's just it's such a system that is so stuck, right? There's so much money involved. And that's really why we are not moving forward with treating the cause of multiple sclerosis, but other diseases. I'm just going to go to your questions right now. Hello. So, hello, Letitia. So, Facebook user, you're saying that you have double vision. We have found just with 4 of our most recent students that had double vision. I don't know if it's the same thing as what you have. It's diplopia, where their eyes would wander and they'd have double vision. Just by following the diet and supporting the body with the Live Disease Free plan, their vision corrected. So, again, decreasing the food to the parasites, the inflammation decreases, and people notice symptom improvements. So, you still want to treat the parasites, but just changing your diet can make all the difference. And I do have the Live Disease Free diet guidelines on our website for free. And you can just do a Google search, Live Disease Free guidelines, or you'll find them on the drop down menus on our Live Disease Free website. But start there. Start with the diet. Start to change your diet. Start to be a believer. Start to learn about the parasites. And if you don't have a practitioner that will support you in treating them and recovering, then make sure to reach out to us simply by watching my masterclass training. Yes, I know, David. There's a 7 to 8 minute delay. I have to do something. I know that a lot of people that live stream, they have like an introductory video so that YouTube and Facebook will start showing it. So I'm going to have to do, I hate to do that, but you guys will know that if it says, I'll be on it and there will be a countdown timer, but then that way you can upload it and then at least they're going to show the video. They're making things like I was a little bit late today too, because my Live Disease Free Facebook page is white, blank. I can't even get onto it. And I don't know, we troubleshooted for a while. Hi, Wendy. And hi, Genia. Greetings from Michigan. Do you guys have any questions? Like, if you have multiple sclerosis, do you have other conditions? Are you just dealing with MS? Another thing is, when I talk to people, some of the people are using the disease modifying drugs, and a lot of people that talk to me, they're not using the disease modifying drugs because they have researched them very carefully and they found like, I don't trust them. I don't really see an advantage to them, and I'm really concerned that they could actually cause more adverse effects than any good. So let me know, like, are you using the disease modifying drugs? Have you found them helpful? Are you not using them? Is there a reason why? Are you dealing with other conditions that not just multiple sclerosis? Is this research true for you also? Or maybe you're like, I have really changed my diet. I've really been working on my health. And yes, I have MS and it's bothering me, but I don't have a lot of other diseases. And that can be the case also. But that is because you've done some effort and you've put in some work on that. Hello, Victor. So, Letitia, my mother has MS, but she passed away from pancreatic cancer. She had MS for 35 years. See? And it's just, and I wonder if she was on disease modifying drugs or not. It's not that she had to have been on, because all of these parasites do suppress our immune system, but it is very possible that if she was on disease modifying drugs, that it made matters worse. So, David, my feet swell or if feet swell or feet like they have socks on them, are these parasite side effects or other? Yes. So any edema, which is swelling, definitely caused by parasites, but it could be, the problem is that what I teach and what the research is showing is that when we have multiple sclerosis or other autoimmune diseases, we're in a state of dysbiosis. So we don't just have like one worm or one type of bacteria or one type of protist that's making us sick. It's multiple different types of parasites. And so we have to correct it. We have to treat the worms. We have to knock back the fungus. We have to knock back bad bacteria and even different types of single cell protist parasites. You're so very welcome, Genia. Together we are stronger, absolutely. So, Wendy, how do you get rid of parasites? Or how do you get rid of MS? So, on our website, you can see a lot of people sharing their journey of following the Live Disease Free plan. And also on YouTube, we have a playlist there. You can listen to their stories, grab some Kleenexes because it's so incredibly moving when you hear their stories, how much they've suffered and how far they've come. And so you'll see their stories there, but what they do to recover from MS is number one, we know that MS is an inflammatory disease caused by a parasitic infestation. So the first step we have to do is we have to decrease the food to the parasites, and we do that through the Live Disease Free diet. And so when they're following the diet and they've got the carbs low enough, they notice a lot of symptom improvements. The next step that they're going to do is they're going to support the body. So before we start treating, we want to make sure that our detox pathways are open. So we're having regular daily bowel movements. We want to be sleeping at least 8 hours per night. We look at our blood work and we support areas that need support. Maybe it's our low iron or low thyroid or B12, or it could be various vitamin D3, looking at our kidney and liver function, just making sure that those are okay. So we support our physiology. And then two other things that are quite important before we start treating is we decrease the wireless radiation in our environment. So this is where there's certain steps we take to decrease and it's coming from our cell phones and our computers and our smart appliances and our smart TV. We're bombarded. And then now we have 5G. And you might even have a little transmitter outside of your home where you're getting blasted with 5G. And all of those things make these parasites grow a lot faster. And we want to make sure we don't have mold in the home. So the radiation and the mold are two things that would really hold us back. So we want to address those. We still can use technology, but we use it in a safe manner. And then we start to treat. So this is where, we've had a lot of symptom improvements. We're feeling a lot better. If we are fairly newly diagnosed, we might almost feel symptom-free. We still have to treat the parasites because if we don't get enough sleep or eat the wrong food or have high stress, we could get more symptoms again. But we want to get to a place where we're feeling a lot better before we start treating. That way, the treatments work a lot better and we tolerate them a lot better. And so this is where our students are then taking common samples of parasite drugs that treat roundworms and tapeworms and flukes and different types of smaller protists and bacteria, Lyme infection. So they're taking a few common, because a lot of our practitioners don't have them in their office. This will change in time, but they don't at this point. So they're taking like a 1 dose of each and they're getting energy tested to see which of the treatments test the best for them. So they're not just taking a parasite drug and hoping that it's going to do something. And the way that we build the plan is by looking at their health history, the health history of their parents, their symptoms, their diagnosis, and then their energy test results. So every living thing has this field, this energy field around us, including us. And when we are exposed to a lot of toxins or infections, maybe other things too, we can have a decrease in our energy. And so certain practitioners, like maybe a chiropractor that does applied kinesiology or a naturopath that does some type of energy testing, sometimes they use machines, sometimes they use muscle testing, they can actually tell when there's changes if they hold that dose of a certain treatment close to us or even a supplement, whether it helps us and balances us or whether it makes no difference. And so then our students come back to me with a list, and then I help them to access the treatments. I help them to access, knowing like with practitioners, like the protocols that the practitioners are using to make sure that if they have a practitioner that's working with them, that they're going to use effective doses so that it's not just going to be a waste of time. And we have worked with hundreds of students using the parasite drugs that are using them, like getting a prescription and working with practitioners. We help you with all of that to access all of the help that you need. And then to make sure that, because the doctors don't have a lot of experience yet in treating parasites, we do, so we can help make sure that you are taking them in a way that you're going to treat them effectively, but you're not going to have a Herxheimer reaction, because we want to avoid Herx reactions. They're not helpful. They make us feel horrible. And it's more just usually like we're either treating too aggressively, or it's angry worm syndrome. We've poked the bear and they're not happy, the parasites, and they're revolting against us and we feel horrible. So we have a very systematic approach. And then we found that the parasite drugs on their own are not a magic cure. If they were, I would honestly write a book and we would be done. So we have to use a combination of oxidative therapies, oxygen type therapies. We've got a really cost-effective way of doing that. And then sometimes herbs, antimicrobial herbs, and then also to use the parasite drugs. And it's the combination, I call it layering of therapies. That is really where and also the prep work that we did before. This is where, like, when you listen to those stories of our students, like Lisa May, and some of them don't just correct like MS, but they correct infertility, and they correct, like these tumors, and they correct epilepsy, and they correct diabetes, and so many different other conditions, inflammatory bowel and arthritis and fibromyalgia, and it goes on and on. It's so incredibly common, all of these disorders, and they're happy again. They don't have depression. They don't have anxiety. They're making plans. They're keeping them. They go back to work. It's really crazy. Like when you start, like some of our students are really cranky, right? They don't feel well. Their constipation is just over the top and nothing is working. And then now all of a sudden one of our students, she's like, I feel freaking amazing. The last 2 emails from her, I feel freaking amazing. That was what she's been saying. And I'm so proud of her. And it's like, we give you the steps, and our students are just such heroes to me, because they're just like, they feel terrible with these parasites, and they're just, no, I'm getting my life back. And they implement really well. And they all have way more recovery than they ever thought possible. I can never promise full recovery. I can't promise that you're going to implement the steps, right? I have no control. But the students we attract, they are so incredibly disciplined, and they are so dedicated to getting their life back. And it's not really hard. It's a very simple plan we follow, but the steps are really important. And if we don't follow them, we don't get the results. If it was as simple as popping a pill to treat parasites, I promise you I would write a book and we would be done with it. It's not that easy. And we're continually learning and learning more. So our students, they have a lot of roundworms. Big, like I personally have passed around 30-inch worm. Yeah, me, little old me. I have passed intestinal flukes. I have passed probably a tapeworm. I'm not sure about that, but the intestinal flukes are pretty easy to tell because they're wide and they're like wider. They're not like a long, skinny worm. But I've shared tons and tons of pictures from our students. Like, watch our videos. I just did a case study a few weeks ago, and I shared what our student was doing and I'm pretty sure I shared what she tested well for as far as the treatments. I shared a whole bunch of pictures of the parasites she passed, and that was just in the middle of the first treatment cycle. And she was already entertaining and having big parties at her house. Like, absolutely incredible, the changes. So it can happen pretty fast. Maybe you've been sick for years and years and years, but it doesn't have to take years to recover. It can happen in months when you're doing the right thing. So hello, Anne-Marie. Let's see, you have headaches almost for 20 years. Please look more into this because you are dealing with parasites. So sometimes the headaches are coming from our gut, but sometimes the headaches are coming from lesions in our central nervous system. And those are pockets of inflammation. They're pockets, not inflation. I know inflation is really bad these days. They're pockets of inflammation, and that is caused by your immune system is fighting some type of parasite in that area. Or it is caused by just even in your gut, inflammation in the gut. So the doctor didn't think that you had MS, but you think differently. It really doesn't matter what the disease label is. Because they don't know what causes MS and there is no cure. So honestly, if you get an MS label, all that's going to help you is they're going to say, well, we'll give you these drugs. And those drugs are not going to stop the progression of MS. You'll still and you'll end up with probably multiple diseases like this study has confirmed. So if you have neurological symptoms, if they find lesions, then you definitely have dysbiosis. You've got parasites in your gut. That's the biggest base camp of the parasites are in your gut. And the more you work on treating that, and yes, some of the parasite drugs that we use, they also do cross the blood-brain barrier, and they are also helping to treat the parasites in the brain. But most of it is really focused on the gut because that is the biggest concentration of the parasites is in your intestines. And as you decrease that more and more, your immune system is going to engage more efficiently at helping to treat different infections in different parts of the body. Okay, a couple more questions here. Hi, John. How can I feel better? I ordered ivermectin um, and you are 21. I don't know what that means, 21Q number. And you're also thinking about taking a dose MS. I personally would not just take a drug like ivermectin, or there's fenbendazole, or there's like, different groups are just, people are desperate, right there. But I'm telling you that if you just take ivermectin, you're not going to get well. Like, what is your goal? Is your goal to recover? If your goal is to recover, then follow a proven plan. Our students are testing well for 3 to 5 parasite drugs. Ivermectin could be one of them, yes, but are you even using the right dose? And our students, if nobody is just taking ivermectin, even when they just test well for it, it's not going to be enough. It's not going to treat the bigger worms. It's not going to treat the ones in the central nervous system. It's not going to treat, if you have the flatworms, it's not going to treat the protists. It's not going to treat the bacteria. So if your goal is to recover, then follow a plan that is proven. Follow a plan that works and treat the dysbiosis and not just throw different drugs. And when we take suboptimal doses of parasite drugs, we do run the risk over a long period of time. We do, and I don't even know how long is a long period of time, but it's just like taking antibiotics. If you don't take the course of antibiotics that you're prescribed, and you just take a lower dose just for a couple of days, you do run the risk of antibiotic resistant bacteria in the future where the antibiotic's not going to work for you. The same is true for the parasite drugs. I personally would not mess around with it. And why waste money buying these different treatments when you don't even know if you're taking the right dose? You don't know if that is even what you need, right? But, John, if you really want to start feeling better, just start the diet. Start following the Live Disease-Free diet. In literally 1 week, you can start to feel a lot better. But you do want to treat for sure also. And type 2, not type 1, low carb helps tremendously, but type 1, there is no cure. Well, all I have shared is that I want to share that we have had students with type 1 and type 2 diabetes, and they have had turnarounds in their symptoms also. So that I know that there's no cure for, they say there's no cure for any disease, right? There is no cure for any disease. But when you're looking at a whole different approach where you're looking at parasites, then all of a sudden people are becoming symptom-free. You're very welcome, Deborah. So bladder condition is a real problem, and that is really common with MS. So the Live Disease-Free diet, if you get the carbs low enough, you'll notice symptom improvements with bladder function in as little as a week. Getting down to 30 total grams of carbs, not net, but total. That includes fiber, sugar, carbohydrate, and everything. Getting down that low makes huge differences for bladder function. Louise, your husband has been diagnosed with MS for 14 years. He also has Raynaud's disease in his hands, and now he has Graves' disease. I'm so sorry. Hyperthyroid. He did the HSCT treatment, which may have caused these, absolutely. So that HSCT treatment, that is where they use chemotherapy and they just completely destroy your immune system and then they bring it back to life. It breaks my heart that this is what we're doing for MS. everything that we're doing for MS. It just breaks my heart. I talk to people every day. I've talked to like several today that are going to be joining also. And just to hear what they've gone through, it's just devastating on their health and what they've missed with their family and their finances. It's just brutal. But I just want you to know, Louise, that there is hope for your husband. There really is, but you've got to take a different path at some point if he's open to it. If he's open to taking this different path, it will change his life. Would all this work with pre-menopause, menopause? Absolutely. So when students join our program, and this is ladies, when women join and maybe they have pre-menopause, maybe they just have PMS, they're postmenopausal, all of these hormone type symptoms, they are symptoms of parasites. For the most part, you could have nutritional deficiencies, and we do take care of that. But for the vast majority of it is that the parasites are more active at certain times of the month. So let's say just before our periods, when the progesterone is higher, they're way more active and we have way more symptoms. And then as we're going through the fluctuations of pre-menopause, perimenopause, right, post-menopause, we call it all that. But what I always tell my students is it just trust me, it's all the night sweats, day sweats, mood swings, cravings, all of those things. Once they treat the parasites, they're like, oh, I guess that's all that it was, because all those symptoms go away. I went through menopause and it was just like, oh, I guess I'm done, because I had corrected the microbes well enough. And so, yes, it's common that we have all of these menopausal symptoms, but taking hormones, even bioidentical hormones, let alone synthetic, it causes a lot of harm, in my humble opinion. These hormones are very powerful, and we just don't understand all of the implications of how it affects the biochemistry in our body. And our body knows how to make the right amount of hormones. So as long as we get our microbiome back in balance, and we're having a lot of different nutrients just so our body can build what it's genetically programmed to build, our students don't have those symptoms anymore. So that's the exciting thing. Okay, I'm going to let you guys go. It has almost been an hour. So if this is all new to you, if this is the first time that we've met, make sure to watch my videos. I've got many videos on YouTube and on Facebook, Live Disease Free. We've got playlists on YouTube, so it's nice. You can look at like the diet playlist, what I eat for breakfast, dinner, and supper. There's an infection playlist. There's a success playlist. Our website is amazing. Like, look at the most recent blog posts. I'm really building a case that MS is an infectious disease. Last week, I talked about a specific neurotoxin that they're finding more common in MS, which is causing leaky brain. Is that why we're having so many more infections in our central nervous system than other people? I've shared pictures of the work of Dr. Alan McDonald of those small roundworms. I've shared lots of pictures of roundworms that our students have passed. I'm sharing the tapeworm larval cyst research, the neurocysticercosis that they're finding in MS. So, and on and on and on. And I'm really helping. And I hope that you share this with different doctors. Like there's all the research is there. They can go deeper into this. I'm seeing a shift. I've been doing this like on a large scale, like in a large group setting for coaching for at least 10 years now. And I'm seeing that there is a growing interest in maybe not with the neurologists, but with different doctors and different integrative practitioners. They're very interested and intrigued with parasites. It's becoming like, duh, like, of course, parasites, really, that could be a problem. So it is very, very exciting that it's coming. But of course, if you're dealing with MS, you can't wait that long. It might take another 10 years or more, because there's a lot of resistance to this change. There's a lot of money involved with this change. And the experts that are deciding how we diagnose and treat MS, they don't feel there's any value in looking for parasites. So that's a really big problem. Although there is research happening, it's not fast enough. So you don't have to wait. You don't have to wait for 5 or 10 years. You can join tomorrow. You can start to build your game plan to treat. So starting to get ready to treat by changing your diet, supporting your body, then getting energy tested, finding out which treatments, and really starting to treat and feeling better than you have felt in many, many years. That's what many hundreds of people have done through the Live Disease Free plan. So if that's where you're at, if you need support, then just you can click on the link to watch my masterclass training. And that shows you all the steps we take in more detail. And there's a lot of case studies there. And then after that, if you want to chat with me, you can book a time to chat with me if you feel that this is a good fit for you, but you just have questions. Some people just join right away. I still am going to talk with you because when we're going to work together for at least 3 months weekly, and then after that, once a month, it's about 6 months we're working together, then we need to have a good, solid starting point. I want to get to know you, what your health is like, what you have been through, what you've done. You can ask questions, and then we're going to start this journey together. And I'm really excited to support you if you need the support. Otherwise, keep up the amazing work with everything that you're doing to change and to take back your health and your life. I really encourage you. It's so worth it. Start with the diet. If that's where you need to start with that. And when you're ready to treat, reach out to us. And please, if you find all of this research that I'm sharing with you, and I will share the study that I've been talking about today, it will be on our blog post. Make sure to go to our website and put in your name and email address so that you can get our newsletter every week, so that you're up to speed on these different subjects, topics, and share it with others. Please help us to get the word out so we can bring change to the way that we treat MS and all chronic diseases. So with that, I'm going to let you go. Have a wonderful week. Take care and bye-bye for now.